Malignant otitis externa. What is that? What is malignant otitis externa? What's malignant otitis externa? Number one.
It's in diabetic patients.
Sure.
When it happens, external otitis happens in diabetic patients.
Yeah, it occurs in diabetic patients. It occurs in diabetic patients, sure. And it's a complication of otitis externa. So remember that we said that what is the complication of otitis media? What did we say? What did we say is a complication of otitis media? Can somebody tell me?
Mastocytitis.
And what is a complication of otitis externa? Malignant otitis externa. Okay. It is like, it has high mortality, all right? When you're thinking about malignant otitis externa, what you have to basically think about is osteomyelitis of the ear canal. Osteomyelitis of the ear canal. And how will the patient with malignant otitis externa present? Look out for these if you're preparing for a board exam. The patient has severe fever or fever which is high. The patient has severe pain. And so if you have a patient who has fever plus severe pain plus facial paralysis, or fever plus severe ear pain plus neck stiffness, then think about malignant otitis externa. We've learned how to diagnose otitis externa. We said it's a clinical diagnosis. We've learned those we are going to take a sample and send for culture from the discharge. Now, how do you put 2 and 2 together to say that this patient presentation is malignant otitis externa? Fever, severe pain, facial paralysis, or meningeal signs. Who is at risk? I think one of the doctors said patients with diabetes. Yeah. So geriatric patients. Number 2, patients with diabetes. Number 3, other immunosuppressed patients. Geriatric patients, patients with diabetes, immunosuppressed patients. All right. Which organism is responsible? You know, all this while we're talking about strep pneumo, Moraxella catarrhalis, H influenza. There are times we can throw in Staph aureus and then group A strep. But when it comes to malignant otitis externa, the organism, please write it down. Pseudomonas aeruginosa. Pseudomonas aeruginosa. That is the organism which is responsible. Okay. And why is malignant otitis externa serious? Because we said it has a high mortality rate. Why is it serious? Because you're thinking about osteomyelitis of the skull. In fact, when patients even have osteomyelitis of the bone, which is in the limbs, look at the way the infectious disease specialists are so serious about it. Can you imagine osteomyelitis of the skull? That is highly, highly, highly mutilacious. The patient can easily die. And what are the complications? The patient can develop a brain abscess. The patient can have destruction of the skull as well. Okay. So, look, that is some malignant otitis externa, which is trying to eat up the bone. Osteomyelitis of the bone, of the skull. That's why they have high mortality. So what investigation will you do? CT scan of the skull and MRI of the skull. CT scan and MRI. CT scan and MRI. Which investigation is the most accurate? So we've learned the initial investigation is CT, MRI, but what is the most accurate? It is to do a biopsy. So remember, there's a difference. Best initial step, next initial step, and then the most accurate step. 2 different things. All right? Again, biopsy. So you can do the MRI and then the bone biopsy, and then you can do a culture. In this patient, because of the high mortality rate, you want to make sure that they are admitted to the inpatient unit, referral to the ENT specialist. They need some strong antibiotics, IV antibiotics, okay? And then they will also need surgical debridement. So that's why you need to get an ENT specialist involved ASAP. And what are some of the complications of malignant otitis externa? They can have cranial nerve 7. Please write it down. Write it down. I'm not going to say anything until you write it down. Cranial nerve 7, cranial nerve 10, cranial nerve 11 paralysis. Which cranial nerves can be affected in malignant otitis externa? 7, 10, and 11. 7, 10, and 11. 7, 10, and 11. And what complication can the patient develop? The patient can develop sepsis. Sepsis. The patient can develop sepsis as well. And then that sepsis can then lead to death. So, doctors, if it comes to approach to ear pain, we finished everything.